Welcome to the Love Your Life and Yourself podcast, the weekly show where science meets soul and mom chaos meets mind mastery. You're not just a mom. You're a woman with dreams, a career, a body that needs care, and a soul that craves more. This podcast is your permission slip to stop surviving and start thriving in motherhood, health, career, and stress resilience. I'm your host, Dr. Ashley Rath, and every week we bring you actionable insights and transformative conversations to help you create a life you truly love. From evidence-based wellness strategies to authentic self-discovery, we'll explore what it takes to thrive through expert interviews and real unfiltered stories. Let's dive into today's episode. Welcome back. Today, we are talking about HRT and if hormone replacement therapy actually fixed hormones, women wouldn't still feel exhausted, foggy, anxious, and emotionally dysregulated 6 months later. And yet, here we are. So today, I want to be clear about something that gets misunderstood online. And that is HRT doesn't fail. It just hits a ceiling of what it can do inside of a dysregulated system. And here's the part that no one explains. So before we get into it, before you get your panties all up in a wad, I am not anti-HRT. I actually work alongside of it. And I've actually debated integrating it within my practice as a tool to use with my patients. I have not yet, but I work alongside and collaborate with prescribing providers. And I have patients all the time who stay on hormones and benefit from them. So this is not a them versus us conversation. This conversation is really about the physiological aspect of HRT and what it is actually doing inside of your body. And once you understand this, the confusion around hormones starts to dissolve. So when most women go to their provider for hormone support, they get some labs done and they focus on what I call the downstream hormones. Or if you go back to episode 22 of my podcast, I talk about the pyramid hormone. The downstream hormones, or really kind of the tip of the pyramid, are estrogen, progesterone, testosterone. The middle of the pyramid, I would consider thyroid in there. But those sex hormones, the estrogen, progesterone, and testosterone, they're the downstream hormones. They're the end hormones. And yes, adjusting these hormones can change your symptoms, but here's what rarely actually gets explained. Those hormones don't operate independently. They sit on top of an upstream system. So at the base of the pyramid is the HPA axis, Hypothalamic-Pituitary-Adrenal axis. This is really your brain and your stress response. It's your circadian rhythm. It's your metabolic signaling. So when estrogen is low or progesterone is high or testosterone feels off, the real question isn't just what do we do to replace that? If estrogen is low, we can give estrogen. If progesterone is low, we can give progesterone. If testosterone is low, we can give testosterone. But my question is, well, why is it high or low in the first place? You see, the thing is, our bodies will respond to HRT. It will. Some symptoms will change. But my question is, well, why are they low or high in the first place? So the non-obvious truth here is that hormones respond to signals. They don't just create them. They respond to stress. They respond to blood sugar. They respond to inflammation. They respond to sleep timing, nervous system safety. So when we start to adjust hormone levels with addressing those signals, we get something very specific. We get short-term relief and long-term plateaus. That's the ceiling. So HRT falls short because it can help certain symptoms. It can raise low estrogen. It can raise low progesterone. It can raise low testosterone. And they're especially effective at helping symptoms like hot flashes, vaginal dryness, night sweats, low libido, because a lot of those symptoms are closely tied to those end stream hormones, estrogen signaling. So when estrogen changes, like in perimenopause and menopause, those symptoms respond fairly well to HRT. But here's what I see over and over and over again is women say, I'm sleeping a little better, but I'm still tired. Or I'm not having as many hot flashes, but I still have foggy thinking or brain fog. My labs, estrogen, progesterone, and testosterone look better, but I still don't feel much better. I don't feel like myself. And that's where the confusion starts because those symptoms aren't driven by hormones themselves. They're driven by some of the mechanisms upstream. So fatigue is often an HPA dysregulation, a cortisol issue. Brain fog is often related to metabolic function or inflammatory responses. Emotional reactivity is often a nervous system tone. So HRT doesn't retain or retrain the stress response. It doesn't stabilize blood sugar. It doesn't restore circadian rhythm. It doesn't resolve chronic inflammation. That doesn't mean that HRT has failed. It means that we're asking it to a job they were never designed to do alone. And so this is where things get a little uncomfortable, but quite honestly, honest. So relief is not the same thing as regulation. Feeling better for weeks doesn't mean the system's healed. It means the body's found a temporary workaround, really. The nervous system will tolerate this compensation for a while. Then it's going to ask for some repair. When it asks for repair and that repair doesn't happen, the symptoms start to creep back in. That's why you see symptoms improve, but then after 6 months, that woman is starting to say, maybe I need a higher dose, or maybe this isn't the right hormone, or maybe my body just doesn't respond. But often it's responding exactly how the body was designed to respond. So I want to say this very clearly. This is not an either or conversation. Let me repeat that. This is not an either or conversation. I don't want patients to think that they're choosing between providers or services. I want collaboration here. So I have patients all the time who stay on specifically progesterone at night because it helps them sleep. They're not getting as many hot flashes. That matters. Sleep is absolutely foundational. If you are not sleeping, you cannot heal and start regulating your nervous system. But we don't want to stop just right there. We want to ask, well, why is the sleep disturbed to begin with? Is it a cortisol dysregulation? Is the blood sugar regulated? Is the metabolic function functioning at its highest level? Or are there signs of A1C being off? Or is this person overweight and their metabolic function is not working properly? Is their nervous system constantly firing in a stress response? Or is it actually feeling safe and rested and healing in the parasympathetic system? You see, it matters how these systems are working because these systems are upstream to all those downstream sex hormones. And if upstream is murky and icky, downstream is going to be the same. So true healing, healing from the root cause, happens when we start asking different questions. When we start looking at root cause scenarios is, how is my stress response? How's my HPA access being regulated? How's my metabolic function? Is my blood sugar being regulated or insulin levels at appropriate levels during the daytime? These are the questions that we need to start asking. So eventually, when people come in, all they want to do is get off their hormones most of the time. Most people don't want to take a bunch of different supplements or a bunch of different medications for the rest of their lives. I would say the majority. And to be very honest, that's a conversation that they have to have with their provider who prescribed them. My role isn't to decide that for them. My role is to help them understand that their body can become regulated enough that the system is actually ready to cope with normal, healthy responses. And therefore, the hormones downstream will start to regulate themselves. So the real question to ask when you are looking at HRT is not necessarily should I be on them or not, but is my system stable enough to actually respond to them? Because the hormones will work best after regulation. You see what I'm saying? So if hormones were the root problem, adding them would fix everything. But the fact that they don't tells us exactly where we need to look next. So we need to start looking at the root cause. Now, HRT is a beautiful thing. It's helped thousands and millions, and it's becoming more and more popular. And I love that it's helping women feel better, more like themselves, drop some pounds. But I think we're missing part of the puzzle when we look at HRT. And that's the question of, why is my system dysregulated in the first place? And that's when we start to look at metabolic function, when we start to look at HPA axis, stress response, insulin sensitivity. These are the questions we need to look at before we put women on HRT for the rest of their lives. So in closing, if this landed with you, I'd love to hear what your thoughts are, what you think of it, if you agree, if you disagree. Give me all the resources. I want to hear all the feedback from it. And until next time, we'll talk soon. Thanks for tuning in to Love Your Life and Yourself. I hope today's episode gave you one more tool or one more truth to help you thrive in your health, happiness, and resilience. Remember, loving yourself isn't selfish, it's leadership. And it's the foundation for building a life that actually feels like yours. If this spoke to you, hit that follow button, leave a review, and send it to a friend who needs to hear it. And if you want to dive even deeper, grab a copy of my #1 best-selling book, Love Your Life and Yourself. It's the heart behind this podcast, and it's helped thousands of women step into a life they actually love. You can find it at drashleyrath.com or through the link in the show notes. Until next time, take care of you and keep choosing to love your life and yourself.